Now, imagine the body as an expert architect, transforming injury into restoration. This is healing. Healing unfolds in two intertwined acts: regeneration and repair. When cells capable of division remain intact, they multiply to restore the original architecture, like liver cells repopulating a partially resected lobe. But when the scaffold of connective tissue is damaged or the injury is extensive, repair takes over. Fibroblasts migrate in, laying down collagen strands that form a provisional matrix. New blood vessels sprout through angiogenesis, delivering nutrients and oxygen to fuel reconstruction. In the early days, granulation tissue blushes pink and fills the wound bed, a mosaic of capillaries, fibroblasts, and inflammatory cells working in concert. Growth factors, VEGF coaxing vessels, TGF beta commanding fibroblasts, PDGF recruiting more repair cells, choreograph this dance. As collagen accumulates, the granulation tissue matures into a scar. Myofibroblasts pull wound edges inward, reducing its size in a process called contraction. Primary intention healing, as in a clean surgical incision, stitches edges together, minimizing granulation tissue and leaving a fine scar. In contrast, secondary intention, where tissue is lost or edges are widely separated, relies on abundant granulation and wound contraction, resulting in a broader, more visible scar. Over weeks to months, the scar remodels. Collagen fibers realign along tension lines, and cellularity diminishes, leaving behind a pale avascular seam of dense connective tissue. Though strength never matches uninjured tissue, this remodeled scar restores integrity and function. Healing is the body's promise of renewal, transforming damage into durable repair, guided by cellular symphonies and molecular signals. It teaches us that even after destruction, life finds a way to rebuild.